for hopping on. I am Zoe, and I have the honor of representing all 24 community mental health centers in our state. And one of the things that the council has been intentional on wanting to do as part of our strategic plan efforts led by the board is providing more educational opportunities, such as this one, that we have our 6 managed care entities that we work with in our state. I'm very thankful that we have a monthly meeting with them where we talk about big picture items. And of course, a big picture item that came up is the public health emergency ending and what each of the MCEs is doing in order to help with enrollment, re-enrollment, educating the clients and those that we serve. And so we thought it would be a good idea to allow time for each of them to provide a quick overview because everyone's doing it a little bit differently. We did do a toolkit for all of you through Covering Kids and Family that Leanne has sent out a couple times and has posted and shared. So this is a little bit extra and also will allow us some time for question and answer. So I'm not going to speak of a lot of council updates, even though that's killing me not to, but I do want to share, if you have not signed up for our spring conference coming up in May, please do so. We have quite an agenda, and one of those is going to be our state Medicaid director at the conference, and then at our business meeting, the new director of strategic partnerships, who's going to talk about their work around managed Medicaid alignment. So would love to have all of you. Would love to have all the MCEs there as partners as well. So I'm going to turn it over to Leanne. So she's going to be managing the PowerPoint and coordinating who's going next. And if you guys have any questions, put them in the chat and we'll manage that way. Thank you so much.
Good afternoon. Thank you, Zoe. And thanks everybody for hopping on. We're excited for this opportunity to learn from our MCEs and just share a wealth of knowledge. I'm going to first start with United Healthcare if they are on and ready, and I will get your presentation up and ready.
And Leanne, yes, we're on.
Wrong one. Sorry about that. Well, I apologize, guys. I can see it on my screen and not get it up. Yeah. Sorry about that.
And if you email it to me, I can do it if you need to.
Because it's not pulling up for me. Let me send that over. Sorry about that. Okay, I just sent that and should be coming your way. It's not on my end for some reason.
Okay, I'm looking for it.
Thanks, Zoe.
There we go.
Take it away, United Healthcare.
All right, thanks, Zoe. And you all have kind of thrown me off here. United being a U is always usually last. So it's a little exciting me to get to go first this time. Oh, goodness. Anyway, I'm Laurie Winesapple, and I'm Medicaid growth for United Healthcare. And so I'm kind of leading a lot of our redetermination efforts here. at the health plan. So I just have a few slides I'll run you through real quick. Hopefully everybody has the basic information about what's happening with redetermination at this point. And if not, we can answer questions at the end because we all can weigh in on that. So just to clarify, United Healthcare covers Hoosier Care Connect program members only. We do not have the HIP or Hoosier HealthWise population. The first redeterminations for that particular program are coming due June 30th. So the first potential disenrollments we might see with our members who are no longer eligible or don't follow through on redetermining will be 7/1 of 23. A lot of our members, because they're disabled, will auto renew, which is what they don't really have to send anything in again if they're on SSI, because they have to keep up with their SSI benefits so that the state automatically talks to one another to make sure they have that information. And then a lot of our members are wards and fosters. So those particular members also auto renew. What we're doing here at United Healthcare, because even though we have a fairly small population at this point, we are new to the market in Medicaid with Hoosier Care Connect in April of 2021. So we saw a fairly small membership, but we certainly want to keep folks on the rolls that are already on. So we have a multi-tiered approach across the nation, actually. And the first tier is always, our outreach to our members. So we have up to 11 member touch points, which I'll show you in the next slide, and 60 days in advance of their redetermination date. On the second level, if you'll go back, second level, we are going to do targeted educational outreach to our community-based organization, faith-based organization partners, our providers, which you all certainly are part of. In tier 3, we do general outreach to Medicaid membership. And tier 4, there's a larger United Healthcare campaign to the general public about what is happening with the redetermination and the ending of the PHE. If you go to the next slide, this slide just kind of details what we plan to do with our current members as they come up. When we get our redetermination date trigger, that will lead to a direct mailer right off the bat, and then followed by the first text and email messaging about redetermination and the importance of renewing. After that is going to come an IVR call, followed by 45 days, followed by the second text and email to those members. 30 days out, they're going to get a live call, somebody that can actually talk with them back and forth and say, what have you done so far? Where are you in your redetermination effort? If they need a warm transfer, if they say, hey, we're no longer eligible, but might be eligible for Marketplace, there might be a warm transfer there to get them involved or that process started. Whatever that member needs to stay insured. What follows next is, again, a third text and email, followed by a final IVR call. And again, we haven't started this yet because, again, our first members come due June 30th. So once we start this, we'll see how it flows, keep track of who we're able to renew, who we're not, and may have to throw in some additional outreach to help make that happen. So if you go to the next slide, what we're trying to do, we have a whole lot of communications that are available to our partners. We're doing some outreach to community-based organizations. So I oversee our outreach team, and we are working with a lot of community-based organizations that interact and serve our members. So we're making sure that they all know what's going on and have some information that they can then also communicate to their recipients or their customers. So we're identifying partners, we're emailing them with information, we'll do visits here and there also. We also are trying to connect and outreach to our providers that are contracted with us. We have already done some of that with our high volume FQHCs. Those are the entities that have the majority, the bulk of our members. So we've done emails, we'll do visits, we'll do member lists, those kind of things. We pretty much have that ball rolling. The other thing we're looking at, and that I know you all are interested in, is looking at other PMPs that our members are assigned to, as well as other providers, including CMHCs, that can potentially help us in this effort as well. What we're thinking on our end is those lists are going to be fairly small, like onesies and twosies here and there. So we're trying to figure out how to do that currently, but we are working on that. I don't have anything definite in terms of how that's going to happen today, but we are looking to incorporate that as well. We've developed all kinds of tools, which I'm going to show you some visuals on that next. We've got posters, postcards, handouts, postcard handouts, tear pads, table tents that can be used in offices to distribute to members. And the next slide shows you a few of those. What you'll see there on your left is a table tent that can be set up in any office. It's got a QR code there that a member could just point their phone at that and it'll take them right to the FSSA website that tells them all about what they need to do to renew their coverage. That second piece in the middle is a postcard, and that's the Spanish version. We have all of this in English and Spanish. So this is a postcard that can also be handed out to members from an office or a community-based organization. And the last thing on there is our poster that can be hung. Again, that's got the QR code that somebody could easily point at, and we'll take them right to the FSSA website. And if you'll go to the next slide, again, here's another visual just about the national ads that we are doing. And again, it's pretty generic, but to any Medicaid person, if their coverage is changing, encourages them to click that button to get started. That is going to go to our UHC national website where people can pick their state. And if they pick Indiana, then they'll go to our website and our redetermination language that has been approved by the state and will help them here in Indiana. So that's basically what I've got today. And I know we're going to do questions at the end, but that's what we've put together for redetermination at this point.
Thanks so much, Lori.
You're welcome.
And we are going to be pulling up the next one. Was that also part of, did you connect that to that same one, Leanne?
The ones that I sent you, they're different.
Okay.
There's two different ones.
Okay, let me pull that up.
And MHS, if you're ready.
Yep, MHS.
Jenny, I think you're on mute.
Okay.
There you go.
Oh, no, there I am. Sorry,
Yeah.
guys. I was just talking away. Darn. My name's Jennifer Garner. I am the manager for provider relations at MHS. Thank you so much for having MHS join the call today to present our efforts for the back to normal redetermination effort. It's our privilege to be here to speak to our CMHC partners. So thank you for the invitation. What I wanted to talk about today is really focusing in on the network side, because on the member side, MHS is doing very similar things, such as United, a full member outreach campaign. However, Because we have provider partners on the line, I really wanted to focus in on some of the provider outreach that we are doing. And so for our providers, really the ask with our provider partners is that our provider partners would, when members present at your offices, your facilities, that you would help reinforce and remind members that it is their responsibility to fulfill their redetermination requirements so that they can continue and keep that coverage. Of course, that's critical for members who are, currently within treatment plans. We don't want to interrupt care. We want to be sure that our members, your patients, remain eligible for Medicaid. So what we are doing is on the provider side, we've done multiple outreach efforts, and one of them is listed here. This was a provider email blast that went out on the 15th of March to our provider partners, really just asking that you help support our members, your patients, when they present at your offices for their appointments. Remind them that they do have that requirement to fulfill that redetermination responsibility. And so that was the first piece. We didn't have a formal presentation necessarily, but really wanted to share on the call today some of the provider facing materials that we have distributed. So that was one. I believe there was a second one as well that was sent over, which was a postcard that went out on the 30th of March to all of our provider partners, letting them know once again, when you have members that present at your office or your facility, there it is, to please talk to them about their annual Medicaid eligibility and redetermination effort. And so it's critical that members follow through with that responsibility so that they can continue their eligibility for Medicaid and receive the services that they need. Some of the other efforts that MHS is doing, perhaps some of you have seen it as well. We have an article, an email that goes out. It's called the Provider Watch. It goes out every other week. We've had articles and reminders in that Provider Watch. If you are currently on the line and you're not signed up for that, you can go to the mhsindiana.com website under the Provider tab, and you can register for receiving some of our publications. And one of those is the Provider Watch. We are also working on our quarterly newsletter. It's called The Communicator, and that as well is going to have material and information listed, really just trying to reach all of our provider partners to let them know, number one, that this is happening with Medicaid. It's been a while, right? A couple years since the public health emergency was activated. So we want to really reach out, make sure our provider partners know that this is happening, because our providers are the ones that first encounter members in most instances. We know that members move, they may not get their mail, they may not read their mail and so forth. And so it's really important, pardon me, when they present at those offices that our provider partners know, whether it's a primary care provider, an FQHC, or in this case, CMHCs, that, the offices, whomever is meeting with the members, that they help reinforce and support the effort to remind members that this is their responsibility. Because obviously members get busy, it can fall through the cracks. And that's what we're trying to eliminate here, is any member falling through the cracks, not realizing that there is an action required on their part to fulfill their Medicaid eligibility. The other piece that we are doing, of course, like United spoke very eloquently about member panels, with our primary care groups, our FQHCs, we are providing, of course, member panel listings, and there'll be some functionality coming very soon on the MHS portal However, CMHCs are a little different because you don't actually have members assigned to your panels. So my best, one of the best resources is your MHS Provider Partnership Associate. If you have a monthly meeting, or if you would like to request a meeting with your MHS provider rep, please do so. We are each and every month talking about the redetermination effort and trying to reinforce that partnership with our provider base to make sure that no member is left, wondering, what do I have to do? And making sure that we really help support the effort on the member side and letting members know how critical it is that they follow through with their eligibility. And so I know we're going to save questions to the end. The last talking point that I wanted to be sure and bring up is that eligibility verification is key throughout this entire year. I mean, it's always critical, but even more critical with Medicaid right now, in making sure that that eligibility is verified at the visits. So one, if an authorization should be needed for a service, that as a provider, you know where to request and send that information to request authorizations. And secondly, from the claims piece, where do you submit your claim? And then, of course, the primary piece is making sure that those members are still covered. So MHS would like to thank our CMHC partners for, any efforts that you offer in aiding us in making sure that members are notified that they do have this requirement for their Medicaid to really secure their Medicaid eligibility. So thank you so much for allowing us to come and speak today. And we'll look forward to the questions here at the end of the session.
Thank you for that presentation. And next up, Anthem is going to share their slides and talk through what they are doing. So Anthem, we're turning it over to you.
Okay, there I am. Hello, my name is Elisa Phillips. I am a provider relationship account manager with Anthem Medicaid, and I'm hoping I am sharing my screen and you are seeing our member website. So if somebody can confirm that that was successful.
Yes,
Yeah.
that's
Okay, awesome. Okay, so I wanted to share a couple of things. This is starting here with our member website, and this is specifically our Indiana members, talking about how to renew. Nationally, Anthem's campaign is called Ready, Set, Renew. And so we have information here available, just reminding members to keep an eye out, in the mail for that notice from the state when it's time to redetermine, and, just letting them know they need to mail or fax back any forms that were requested by the state. We do have a video available. We have it in English and in Spanish. So it's it's very short. I'm just going to play it here real quick for you.
Hey there. We hope you've enjoyed your health benefits over the past year. Here's an important reminder. You need to renew your benefits every 12 months to keep them. If you don't renew on time, you could lose your benefits. But don't worry, just follow these easy steps to renew your benefits now. Keep an eye out for a notice in the mail. Complete your form and gather documents. Send your information back. And that's it, just 3 easy steps. If you have any questions about renewing your benefits, call us at 1-866-408-6131, TTY-711 for Healthy Indiana Plan and Hoosier Healthwise, or 1-844-284-1797, TTY-711 for Hoosier Care Connect. Also, if you moved this past year, the state needs your new address. Call the Family and Social Services Administration at 1-800-403-0864. They can also help you with your renewal. We're happy to have served you over this past year. Renew now to make sure you keep your Anthem Blue Cross and Blue Shield benefits.
Okay, so that's some information we have directed towards members. And then I also wanted to share some, some resources and things we're making available to the providers and specifically the CMHCs. Lissy Lobb will be providing each of the CMHCs with adding the redetermination date to the MRO reports. That way, for all of your MRO members, you will have that redetermination date on that report so that you can, again, as others have talked about, working with your patients to remind them of when their time is to renew so that they can be on the lookout for the information from the state to renew or to get their address updated if that's needed so that they are getting that information in the mail so that they know that they do need to comply with those documentation requests in order to keep their benefits. So be on the lookout for those MRO reports coming your way this week or next with those redetermination dates. Another opportunity we have available is to have our marketing and member engagement teams are available to come on site, set up a table and be there to talk to members about redetermination. And the member engagement team can also be there to actually help members, being able to look up specific information about them, about when they need to redetermine or, help them, specifically with that process. So that is something we have available. So if anyone is interested, please, you can reach out to me and I can get you connected with our marketing team to get that set up. And then lastly, right now, you do have access to that redetermination date via Availity. Right now, that is only available, on an individual basis. So if you're looking up eligibility on a member, you are able to see that redetermination date in Availity. So we are exploring some options of making that, available in more of a report format, as others have talked about, specifically maybe in a PMP panel report. Those are being investigated, but that individual redetermination date is available to you. And the videos are available. We can work with the marketing team to get those videos available to you if that's something you'd like to, share in your offices as patients are waiting. And so again, like the others have said, we really, appreciate the partnership with the CMHCs and an opportunity, to all work together to help our members, your patients, keep that eligibility going forward. So that's all I have. So I will stop sharing and turn it back over. Thank you.
Thank you. Thank you so much for sharing. And next up, we have MD Wise, and they are also going to be sharing their screen.
Great, thank you.
Welcome.
Thank you. So, there we go. And can everyone see my screen okay?
Yes.
Awesome. And I'm gonna do some show similarly what Anthem just showed. When our members, providers, anyone, when you visit our website, we have a, can't miss it, yellow banner at the top so everyone is aware. And so that hopefully encourages individuals to click on it. And this is where they can find, we put information here for our members to find out how to update their information, what they need to do. And we also, similar to everyone else, we have different campaigns going out where we have postcards, mailings with this check your coverage logo on it, and it's going out to all our members. And then of course, we'll be reaching out to those members whose redeterminations are coming up as well. And again, it'll have that check your coverage. We kept that branding that the state used. So when everyone sees it, they know exactly what it is. And again, we just have information on here to educate them on what steps they need to take to update their information with links that take them over to the FSSA portal. We're encouraging all of our members to create their portal account if they haven't already, and check their information if for whatever reason they may have recently moved and that change hasn't hit us yet, so that they'll be able to see those missed notifications in their member portal. And as well as, so a lot of the things that the other MCEs are doing, we're doing as well. So we're providing our providers with member lists of those members who are up for redetermination, as well as working on incorporating those redetermination specific dates for those members as well. And also in terms of community engagement, we are out in the community, my team, participating in events, as well as we're doing community presentations. So if there's organizations that you work with or agencies that you work with that come in contact with, we're available to do presentations to educate the staff so they know what's going on and are better able to relay the message to their patients and clients that they're speaking with, as well as also providing community presentations for individuals. So if there's a church meeting or any type of community meeting where community members are gathering, we're making ourselves available as well to be on site to provide this presentation to those individuals to educate, as well as providing on site. We'll have iPads, so we'll provide electronics. So those community members who may be at that meeting that we're invited to, they'll be able to get assistance right then to log into their member portal account on FSSA's portal. And also if they wanted to, they could apply for coverage if they needed to do that, or also as well, we'll bring a navigator along with us. So they'll be on site as well to answer any questions that members may have that pertain to eligibility, or any questions or issues that they may be having, or not understanding the redetermination letters that they are receiving. And so just to keep it quick and short, because a lot of the information that's already been shared is a lot of things that we're doing as well, but I definitely wanted to show our website to show that members and providers can utilize this site to navigate to get to the FSSA portal, and just encourage your patients and members that you interact with to create that portal account so that they can have quick access and know what's going on with their coverage right then and there. And I will be here at the end as well to take any questions if you have any. Thank you.
Thank you, Rachel. And I believe CareSource is our last. If you guys want to share your screen as well, and then we can get started. Thank you.
Sure. Okay, hello everyone. Jessie Rockhill with CareSource. I'm the Member Engagement Director. And boy, what a tough act to follow everybody else here. I'm probably going to echo what so many others have said. But to add a little bit more information for you guys, I wanted to talk about who are the CareSource members who are at risk. So at CareSource, we do the HIP and the Hoosier HealthWise program. It's about 40% of our members that will have to take action to maintain that coverage. And it's split pretty evenly between those two programs, HIP and Hoosier HealthWise, slightly leaning towards Hoosier HealthWise, with about 9% of those members who have actually aged out of the program since the protections were put into place. So those members we just have our eye on, because hopefully they will transition over to HIP through the redetermination process. Everything else pretty closely mirrors our membership at large. Of course, the majority of members are here in Central Indiana, Marion County. Allen Lake, Vanderburgh, and St. Joe are the next sort of big areas that we see are at-risk members. And then a few other counties I thought I just mentioned that rose towards the top: Tippecanoe, Madison, Howard, Wayne, and Delaware are also a significantly larger area of our at-risk members are there. Trying to work hard over here to figure out who these members are so that we can get all of the same great information Our approach at CareSource is in what I would call sort of 3 campaigns. So we're doing an FYI campaign, which is changes are coming. You might need to take action. Please check your mail, open everything that you receive, respond by the deadline to make sure you don't experience a gap in coverage. The second campaign is what I'm calling an opt-in campaign. So make sure your contact information is up to date, both with the state and with CareSource, and then opt into receiving those digital messages to make sure you're not missing any important information as things come out about this. And then finally, and I'm showing an example on the screen here, our Act Now campaign is very specifically targeted at those at-risk members, those that have to take action to keep their benefits. It tells them how they can complete it and encourages them to connect with their local DFR if they need more assistance. I've heard several of the other plans mention the FSSA portal. I'm not sure if everyone's aware, that's actually a new functionality. So before the pandemic, members were not able to complete redetermination through the portal, and now they can, which is really great. And I think is going to be really, really beneficial for folks. And FSSA on their YouTube channel has created some really good videos that show how members can redetermine virtually through the app. So if you have members with questions, that's a really good place to send them. And then similarly to everyone else, the way that we're pushing out these 3 campaigns, we have general messaging that goes out to everybody. So social media, website, newsletters. And then we have targeted messaging for those identified at-risk members through the mail, through text, through email, through portals, member portal. We are doing live outbound phone calls within the 30 days of people needing to complete that redetermination packet. And then we are leveraging our staff, trying to meet members where they're at. So anytime members call into our call center, the staff will be able to see if that is an at-risk member and have that conversation and capture them on the phone at that time. We're also going to lean on our care managers and our life coaches from the Job Connect program and ask them to provide one-on-one support for anyone who's at risk and might be enrolled in those programs as well. Our goal is to then trickle all of these campaigns and all of these mediums that we're going to be sending it out through at the 90-day mark, 60, 45, 30, and 15 to very strategically mirror what the state is doing as well. And then partnering with our providers, like all of our lovely folks on the phone, community partners and pharmacies through newsletters, notifications, and really trying to work collaboratively with those who are interacting with our members. So we are providing those lists of those at-risk folks to all of you. And I think I saw Brittany mention that in the chat, so that's great. My parting words are the best advice we can tell folks is just to reiterate what the state is saying and what all of the MCEs are saying. We need members to update their contact information so that they're getting all of this vital information, opening their mail, completing the forms by the deadline provided. If a member is at all unsure or unclear, have them call the 1-800-FSSA number or reach out to their MCE, and I think all of us can provide that assistance. So that is all for me. Thank you all so much.
Thank you,
Okay.
Jessie.
Yes, thank you, Jessie. So Leanne put the toolkit for all of you in the chat, but I did want to highlight this because it was a collaborative effort amongst several agencies. And so can everyone see that okay? So here you have your resources that are available to you that you can be able to share with your clients and patients. There are specific resources for navigators, which I know several of you have navigators on staff. And so these can be used as well. Here are each of the agencies, including the managed care organizations that were a part of this toolkit. And then what I really liked up here from an outreach standpoint is there is education on newsletter about what you can put on your newsletter and different scenarios. So for those of you who do newsletters or email updates, you could take some of this stuff over here from the health centers or other medical providers and be able to share some of that communication there. And so very similar to other toolkits that we have worked with, you really should have everything you need here to also connect to each of the MCEs. So I wanted to make sure that everybody had a chance to see that. And thank Leanne for her work on that with the other agencies. So we're going to pause there now for questions. Any questions for the MCEs that are on the line? Because now would be a great time since we have 74 participants regarding this whole process.
I had some issues with my computer at the very beginning, so I might have missed this. But have the MCs just stated when the power accounts are going to be required again? Was that discussed at all?
Oh, but that's a great question. Would one of you like to highlight that around the power accounts?
I can take it. We haven't heard anything yet. All we know is the earliest it could be turned back on is July, but we haven't heard word back if that's still a go or not. Some more to come. Just be on the lookout for some more updates. We just know they said the earliest would be July 1st.
Thank you. I have a couple other questions. Sorry. When you guys are discussing the redetermination, you're only referring to the Medicaid redetermination, correct? Not the medically frail status that you guys determine when we're doing HIP and we're trying to apply for the state plan for medically frail. Before the public health emergency, we did have to do like yearly updates with that for some clients. Has that been put back into place, or as of right now, we're just sticking to the state's version of redetermination?
So this is Heather Greenwell from MHS, and I am going to attempt to answer the question. I think this is actually a question that we've escalated back to the state because we are also seeking some clarity around that. Our understanding currently is that if the member was set to redetermine, for example, in April of this month, and that coincides, of course, with their reevaluation of their medically frail status, that would be completed as well. So again, we've sent this specific question to the state to get a really clear response, and would be happy to share that response with the council to kind of disseminate to the group, if that would be helpful.
Yeah, that would be great. What other questions? Brenda, you said you had a couple more, but does anybody else have any questions regarding this? I know one that has come up from members just in general, kind of more on a macro level, is the homeless population, and with addresses changing, and what are some things you all are doing to try to connect with our transient population? Anything in particular regarding our homeless and transient population?
So this is Heather from MHS again. I will, Zoe, share with you, or perhaps Leanne, a list after this meeting. So our community relations team does have several kiosks, if you will, that will be or are currently placed in different locations throughout the state. And of course, that may include some shelters. And those can provide them some kind of prompts or how-tos on using the kiosk to start that redetermination process. So that's a takeaway for us, and we'd be happy to share that as well.
That would be wonderful. Thank you. I was hoping that you were going to share that because I remember on our call with the MCEs, we were talking about the kiosk placements in the shelters, which could be really beneficial. Rachel, you were going to add to that or say something, or was that pretty similar?
Yeah, it's pretty similar. And then also, I know here in Indianapolis, I'm making sure to interact with the transit population. And I know here that they could use Horizon House as a mailing facility or a place where their mail could go. So if you know of churches or organizations like that where the transient population could utilize to send their mail to, that's what we've been kind of helping. And I know up north, my rep works at a homeless shelter that's also a capability. So that's some of the ways we're trying to address those individuals who don't have addresses, if that's a ability in your area. I know it's very different depending on which area in the state you are in, but that is a possibility as well.
Great, thank you. Any of the others want to share in particular around that?
Yeah, this is Jessie again with CareSource. This is an issue that is of so much importance and so difficult, and we really have to rely again on meeting our members where they're at. And so our community partners are really key in reaching this population. And so we've got some great partnerships going where we're again sending lists based on zip code of members with the last known address, and have the community partners really do some footwork out in the community. And then we have regional staff all around the state who are going to be doing that as well. So definitely a challenge, and I think something we're all trying to be creative about.
Great. Give it one more sec in case any others want to weigh in. What other questions from our members? I guess a question for all of you to help us in this connection and getting people still covered is, how is the process going? And is there anything, I mean, we have the MCEs on the line, is there anything that you could use that would be more helpful, beneficial? How is it all going at your agencies? Anyone want to share? It's a beautiful spring Monday. Everyone's looking at the sun. Okay, well, if you don't feel comfortable sharing that publicly and you do have some suggestions, the council is really honored to have strong relationships with each of our MCEs and have open communication. And we do a call monthly with them to talk about macro level issues, as well as we do our revenue and billing call, which a number of you participate in. And so anything that we can share around this process with them and how we can align and come together to ensure people keep their coverage would be fantastic. Do you know when HIP co-payments will be reinstated? Does anybody want to share on that? I do not know that off the top of my head. I know I've seen it, but I don't know the answer. Do any of the MCEs know the answer on that? Heather?
I don't. I was trying to quickly, Zoe, get to the last sort of FAQ that FSSA pushed out to us to see if it's here.
I don't think it will be before July. I agree with Sandy.
I think it's probably going to be aligned with that date. Yeah.
Okay, good question. And will they also still be $4?
I don't think we've been told that that's changing, but if someone else has heard differently, please share.
I've not heard that it's changed.
No, I haven't heard that either.
Okay, great. Sandy, you asked for the PowerPoint, and since it was from a variety of folks and website, we will share this recording out with everyone through our member portal. But we do not have like a formal PowerPoint, since some just shared their website. So we will share this recording. And then you have the toolkit. And if there's anything else that you guys need, please do not hesitate to reach out. Denise also shared the link to our spring conference, because I think there will be several updates from state Medicaid on this as well. So please join us. That will be in Plainfield. And we will be celebrating a number of things that day, including our Legislators of the Year, as well as Barb Scott, Aspire CEO's retirement. So look forward to seeing all of you there in May. In the meantime, if there's anything you need, please do not hesitate to reach out to us. And thank you so much for joining this call. And to the MCEs, thank you for being here and providing this education. Thank you, Leanne, for your work. Have a great day, everyone.